Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. We're here today at Bell Works on another gloomy summer day. I think I talked about this last time, but the summer has just been very strange with like the air quality and this just very rainy summer we've had. It's been strange. But I'm sad that it's almost over because then it'll be back to school and all the things, right? My daughter wants to sign up for 17 extracurricular activities, which is funny. My son, when he was growing up, I had to beg him to sign up for basketball or anything. He did Cub Scouts for a long time, but and then he got into drama a little bit, but my daughter will say yes to anything. She's like, yo, chess club? Sure. Yeah. Want to do karate? Absolutely. So
Kate, how old are your children?
So my daughter's 8, my son is 19. So it's, different. I'm in a different worlds with both of them, but yeah, it's funny. So we're trying to narrow down what we're doing. I think we've narrowed it down to tennis. She wants to do she did an acting camp over the summer. So she wants to take some classes at the shout out to Middletown Art Center. This great, I love it there. They do really great programs. So I think we're going to go there, and then also choir, which she does at school, and cheer, which she does at school. So 4 things, but I only have one little one that I'm running around. I don't have multiple, so I think it'll be somewhat manageable, but also pray for me.
I remember those days.
Yeah. So that is, so I'm going to enjoy the next, we have 2 weeks kind of left, one weekend, and then hopefully Labor Day will be nice, and then we're going to get into the thick of all things routine, right? But today, our family healthcare series returns with Hackensack Meridian Children's Health, and a really important topic today. We're going to be talking about all things breastfeeding. Thank you so much to Casi Leahy for joining us today. She's a doctorate-prepared nurse with 24 years of maternal-child health experience. Casi is the clinical program manager at Lactation Services at Jersey Shore University Medical Center.
I know it's a mouthful.
A designated baby-friendly hospital facility, and the clinical director for this center of breastfeeding with locations in Neptune and Jackson. So many interesting things that we can talk about today. I'm really excited to talk about my own experience with breastfeeding, all the resources available that we were just chatting just briefly, before we got started about these support groups for women who are breastfeeding, and probably things I wish I'd, even, I don't know if they existed back when I first had my son, almost 20 years ago. And becoming a parent, I think is
not for the faint-hearted.
Not for the faint-hearted. It can be a little, I don't know if the correct word is jarring, but it can be a little surprising, right? What to expect, right? And breastfeeding, I think, adds another element of, it can be easy for some women, but it's also can be really challenging for others. In my experience, it was mostly challenging, and it's something that, you kind of want to do for, obviously for your child, right? You feel I don't know, I felt like I was failing them if I wasn't nursing them because of what you were told and what you read and stuff like that. So really excited to delve into all things breastfeeding today. Tell me a little bit about how you got into, the services at Hackensack and what you do at the center.
Sure. So I started my career in labor and delivery at Jersey Shore, and I quickly learned that my favorite part about nursing is really the education piece. I like to sit with my patients. I like to chat, want to hear all about them, and I really want to offer that extra support and education that they need. Because you pointed out, becoming a parent, we prepare so much for the delivery, but the work is really after the baby's here. And it can be very overwhelming.
Yes, that was the word I was looking for. Thank you. Overwhelming, not jarring.
Overwhelming is a better description. So breastfeeding is natural, but it's a learned behavior. So taking a class and reading a book and trying to do all the homework before the baby arrives is one thing, but the learning on the job is something that it's really hard for parents to wrap their head around, because under the very best of circumstances, it can be challenging. And then you throw in those traditional booby traps and things that new parents may face, like concerns about milk supply or latching issues or painful experiences. And parents need that extra support and help in order to succeed.
Yeah, right. And also, add in, working moms, right, that have to go back to work, and then, pumping, and just like all of the
a whole other layer.
It's another layer, right? And it's not, like you said, it's not for the faint of heart. So tell me, what are the health benefits for breastfeeding overall, right? And you mentioned that there's new guidelines now in terms of the length of time that is suggested that you do breastfeed your children. And also, is it better if you can even do, like, I know that colostrum is known to be it's like gold, like liquid gold, right? But is there, if you could at least do that for a month, is that better? And how does it all work in terms of, from a nutritional standpoint for your child?
Really good questions. So maybe I'll just start with any breastfeeding is helpful, right? We don't have to put time limits on it. We don't have to put amounts. It's not an all or nothing scenario. So helping families figure out what's going to be best for them and how they want to feed their infants is really important. Most families make the decision on how they plan on feeding their babies during pregnancy, prior to birth. And they have, I'm going to call it an infant feeding plan in mind when they come into the hospital. And a lot of times that plan is based on recommendations. So the current recommendations for breastfeeding is that it's recognized as the optimal form of nutrition for infants worldwide. And as of last summer, in June of 2022, the American Academy of Pediatrics updated their policy to highlight that breastfeeding exclusivity for the first 6 months of life is still recommended, but the continuation was moved from 1 to 2 years, which was a significant change here in the United States. The rest of the world had always had that 2-year stipulation through the World Health Organization guidelines, but the U.S. had updated that policy just last year, and I think it's really surprising for parents when they hear 2 years because they're unfamiliar with that guideline, and more importantly, the idea of navigating back to work or back to school and all the other challenges that they face, it makes that recommendation feel unattainable for some families.
Well, I'd imagine too, I don't know what the statistics are, but I would gather that outside of the U.S., the maternity leaves are significantly longer. And is it across the board? I mean, I know it's in many
it's not across the board, but you highlight we have this recommendation, but we don't have those resources in place for families to succeed, like extended parental leave, family leave,
right?
Easy navigating back to work. We are moving in the right direction. There's a lot of positive legislation that's come out over the last few years, particularly here in New Jersey. New Jersey's kind of ahead of a lot of other states.
Oh, that's great.
So we breastfeeding is a protective class here in New Jersey. We have a really strong return to workplace legislation that covers families who are pumping at work. Families who return to work are protected for however many times they need to pump and however long they need to pump at work. And there's no age stipulation.
Oh.
And it also protects all families, all parents when they return to work, regardless of their workplace, as long as it's not an undue hardship for a smaller business.
Okay.
Is really the language there. So it's exciting to have all these things. New Jersey passed New Jersey strategic breastfeeding plan last year. My gosh, that's a tongue twister. I'm so sorry. And it's revolutionary because we're the first state to have a breastfeeding strategic plan. And the overall goal of this plan for the next 5 years is to normalize breastfeeding for families, to line up those resources, connect with community partners so that everyone can better support families here.
Oh, wow.
So I'm excited about that. It was a partnership to put the plan together through the Department of Health, the Central Jersey Family Health Consortium, and the New Jersey Breastfeeding Coalition.
Okay.
And they brought together stakeholders throughout the state, healthcare providers, community health workers, doulas, physicians, nurses, insurance providers. So they brought everyone to the table to kind of look at what we have now and what we're doing and how can we better serve everyone.
Okay.
So that's exciting.
It is.
So going back to what you had originally asked, I'm sorry I can easily
yeah.
deviate here. So
there's
you
a lot
gotta
of information.
rein me in when I do that. The recommendations are out there and the health benefits are well recognized. So for infants, the benefits include better immunity, lower risk of GI issues for lifelong benefits for that, lower risks of overweight and obesity, lower risk of allergies and infections, lower risk of childhood leukemia and lymphoma.
Wow.
And that's a big one. And, we just came off the global pandemic here with, COVID still in our community. We're starting to see a little bit of a rise again.
Mm-hmm.
But families, infants who receive breast milk, it's almost like they get a passive immunity anytime they get any amount of breast milk. So it's always beneficial. And then the benefits for mom are good too. For mothers, there's a lower risk of breast and ovarian cancer that's dose dependent. So the more they do and the longer they do, the more protected they are. There's also a lower risk of type 2 diabetes for women who breastfeed. And there's a lower risk of type 1 diabetes for babies who are breastfed.
Oh, wow.
So it's exciting stuff.
Is it true, too, that you lose the baby weight faster from nursing, or is that not always the case?
That's what they like to say.
Yeah, I know. I found that, I think, yeah. But I didn't know if that was like a actual fact.
I think for some women that they will tout that as a benefit, and others might be disappointed when that doesn't happen. So I hate to promise anyone that outcome.
Lose all the weight. Yeah, but it does make you ravenous because you're just depleting, like they're sucking it all out of you.
Lots of extra energy loads, that's for sure.
Totally. So I'll talk about my own experience nursing. I was a young mom, as my listeners all know. So I had my son, was like almost 20, and was very not concerned, but I was very dedicated to not being that like quintessential like young mom, right? So I wanted to do all the right things, right? We got our own place, we got married, we were young, and I wanted to nurse. I didn't want any help. I didn't want to say that I got any help. And in hindsight, I think that's just being motherhood and like having that attitude, like, oh, I can do this, and I don't need anyone to, to help me and stuff. So I didn't know that at the time. So I remember my son was born and he was jaundiced. So I didn't realize like how difficult, nursing was going to be. So like him not latching, and then we were discharged from the hospital, right back into the hospital for 2 days, and he's like in that UV lamp, right?
Phototherapy.
Right, yeah. Which was really traumatic to me, as a new parent, because they're, they want to be swaddled, but they can't be because they need the light. So they're screaming the whole time. It was really not a fun day. So
it's very stressful.
Yeah. And then when he was about 4 weeks old, he developed like colic. So he was very colicky and screamed his head off. And it was really challenging because I don't know. I think maybe there's probably been a lot of advancements since then, but like everyone kept telling me it was something I was eating, right? And something that was in my breast milk. But I was like so concerned about giving up like nursing him, even though it was like difficult. I we talked a little about this before, but I am not like a big breasted woman. And I always thought that it was like because I couldn't produce enough milk because like my boobs weren't big enough. So there was all these things, and I'm reading books, and the internet wasn't like how it is now. So I'm like reading in like What to Expect or whatever book I got.
That book is still popular today.
And then calling the doctor every 5 seconds. It was a lot, and I made it to like 5 months with him of nursing, but then like started introducing formula. And I did feel like I had not failed him, but like I'd failed like breastfeeding for sure. But I think because he finally like at that mark started like not being as colicky and was like, kind of becoming like more, mobile and crawling and stuff like that. So it became a bit easier. And then he was, sleeping better. So there was a lot of reasons like why I went to the formula. But what do you tell parents when they're kind of in that situation? I'm sure you've heard this story in multiple iterations, over the years. So what would you have said to me? And like, what, can you say to parents that are going through this right now? And, frustrated and struggling through it.
I have two things that I'm thinking of. The first is, a lot of times when I'm out in the community, when people hear what I do for a living, I do hear a lot of breastfeeding journey stories. And sometimes it'll be in very public places or at events that have nothing to do with healthcare or breastfeeding. And usually what I like to remind families after they've shared a story, and I'm going to say the same thing to you, you might not have had all the resources that you needed at that time to make decisions that could have been led to a different outcome.
Right, for sure.
So I want to highlight what we do at Jersey Shore. We've got our Center for Breastfeeding. We're located in Hope Tower, which is a building right next to Jersey Shore, and we also have a location in Jackson. But my partner, Linda Carroll, and I, we're lactation consultants. We're nurses. Helping families navigate that journey is important. It's not a definitive science. Like even now in hindsight, I can't say, oh, well, it was X, Y, or Z that you were dealing with. And if you had done A, B, and C, then everything would have been perfect, because it would have been a work in progress. We would have had to look to see, are you comfortable? Is the baby comfortable? What do we think is going on? Sometimes that reflux-like behavior, that colicky behavior you described, can have different root causes or contributors. So it sometimes can be a mother with a larger supply or a forcible milk ejection reflex. It could just be normal reflux behavior for an infant, and if it's progressing to the point where the baby isn't gaining weight appropriately or is uncomfortable or in pain, then we would have to consider medical management of reflux situations. And it could also be, you had mentioned allergies. Allergies are intolerances related to different food items. So sometimes when a mother eats may influence the baby. We don't start off telling families to eliminate or avoid any foods because, that would be overkill. That's too much. But if we have a baby who's showing symptoms, then we put our detective hats on and we try to figure out what might be the causes of these symptoms and drill down to see what's going to be most effective for that family. So it's that ongoing work with the family to identify what we think are the issues and the possible causes, and then see them through until there's resolution.
Okay.
And that's really important for new families. Like, you don't want to feel like you're on your own. Your pediatrician, of course, is always available. Our pediatricians in Monmouth and Ocean County are really wonderful. They're available 24/7. But when you've got these questions about infant feeding, it's nice to have some other people on your team, I guess.
Yeah, and it's more specific too. Like, this is what you do, right? So you've heard it all and seen it all, and you know exactly kind of where to point them in the right direction. Let's talk about supply. I've heard. I don't even really recall what I did. I want to say maybe if there was something that I read that you could take, I probably took like a supplement or something. But is that true? We are like a society now where I think we focus more on hydration, but I think 20 years ago we were not. And I don't recall ever like carrying a Stanley cup like I am today around with me with water. And I definitely was not consuming water, to the length that I do now. Does that impact your milk supply, staying hydrated? And also, like, if you don't have, what are the factors that would cause you not having a good supply, and why? Is there, like, do supplements work, or is it all kind of, all a big scam, the things that you can buy online? I asked you like 70 questions. So
I know I'm making a little list because I'm going to forget. So maybe I'll just start with, I think the number one reason why families introduce formula supplementation earlier than intended, earlier than they wanted, is because of a perceived milk supply issue.
Right.
Sometimes, I don't think, in my experience working with breastfeeding families for the last 25 years, I don't think I've ever met a family or a mother who hasn't at one point expressed a concern about her own milk supply. And I think that's worth acknowledging, right? Like, it doesn't matter what size you mentioned your size of breast before. The milk storage capacity and mother's milking capability is different from mother to mother. But there's very few mothers that have medical reasons on why they wouldn't make a full milk supply. Mm-hmm. Milk production is based on milk removal. So if we have a baby that's feeding effectively and that's able to feed at the breast, or we're utilizing a pump to express or remove the milk from the breast, most mothers will be able to make a full milk supply. The idea of hydration is interesting, and I will say research doesn't support that hydration has an influence on milk supply.
Okay.
And they've dived into it a lot. How much should we be drinking? If we're just talking about just people in general, you'll get a lot of different opinions when you dive down that rabbit hole. So the current recommendations are to drink to satisfy thirst. The idea of measured amounts has, not been evidence-based supported.
Okay.
Anecdotally, I've met tons of mothers who will say, when I'm feeling like under the weather, I'm feeling kind of down, if I'm not taking care of myself, I find that if I push a lot of fluids that things seem to improve and my milk supply seems to improve. And I'm certainly not going to argue with any mother who says that to me. So,
I mean, hydration, even like during pregnancy, has impacts a lot of like complications, I believe, too, right?
You can get uterine contractions if you're dehydrated. We're coming off of this really hot and humid summer where the weather temperatures are so high.
Right.
So for dehydrated pregnant women, they are more likely to get contractions. So, keeping themselves hydrated in the heat. So I think overall, when we just talk about humans, we could all probably drink more water.
Sure.
But in regards to breastfeeding, there's not a certain amount that I would recommend other than to say just keep yourself well hydrated. And
Gotcha.
Carrying around your water bottle is good.
It's good. It can't hurt, right?
Can't hurt.
Okay.
And then the other piece of what you had mentioned was when you do have a lower supply or you have a supply issue or you're concerned, what do you do about that? So first, if I would just open with, if you're a breastfeeding parent and you're worried about supply and your baby's gaining weight appropriately, I would say everything's fine.
Okay.
If you do have a supply issue, finding out why you have that supply issue is a good first step so that then you can course correct. So if the baby's not feeding effectively, we can work on latch and positioning and milk transfer at the breast and see if we can improve that. The consultations with a lactation consultant often involve a weighted feed where we'll go ahead and weigh the baby before and after feeding, even during the feeding, and see how much milk they're actually transferring. And then we know how much milk a baby should be transferring, so we've got that expectation in place. Okay. So if there's a disconnect, we can identify that and then work on strategies to care plan that will course correct for that family.
Okay.
Other substances like lactogenic foods that are thought to increase milk supply, or herbal supplements, which we call galactagogues, herbal supplements that are thought to increase milk supply, are not evidence-based, but again, anecdotally, we've got a lot of parents who will say if they eat a lot of oatmeal, oatmeal is thought to be a lactogenic food, that it can positively affect their milk supply. or if they use herbal supplements that traditionally in many cultures have thought to have been helpful, that they have a positive impact on their supply. When it comes to the herbal supplements, there are some health risks depending on the mother's past medical or surgical history. So it's always good to talk to a lactation consultant or the pediatrician if you have concerns.
Interesting. Okay.
And your obstetrician too. I'm sorry, I shouldn't have left them out. Obstetrician and midwife.
Okay. Oh, I didn't even think that you would reach out to them. That's interesting.
When it comes to breastfeeding, it's kind of hard. Like traditionally, who do you reach out to, right? Your pediatrician's in charge of the baby, the obstetrician's in charge of the mother. So sometimes parents, when they have a breastfeeding question, they're not sure who to ask. And I'm going to say you can ask both of them. Jersey Shore is a baby-friendly hospital. We've been baby-friendly since 2012. So our providers and our nursing staff, they've all been trained on infant feeding and managing feeding-related issues. So they're great resources for any family who needs additional help, as well as your community lactation consultants.
Okay. Let's talk about pumping.
Okay.
So I recall, two things. One, I recall, having a newborn, if you 1 kid, 2 kids, 5 kids, it's exhausting. So I recall pumping initially just to have, the ability to sleep a little bit more and to have my partner, feed the baby. And then also, just with working or just not, being accessible, right, to the baby, that to have like the supply, right, of breast milk. But that also was challenging to me because I felt like if I pumped, then that was like my supply. And I know you're supposed to you're supposed to keep doing it. So that way your body, I guess, builds up the amount that you think, but then it would backfire because then I was pumping more, but I wasn't on a schedule, right? I guess that's kind of maybe what the problem was. So the supply was an issue because if I pumped, then I didn't have enough for him, when I just wanted to nurse him. What do you tell moms when is that a common thing that you hear? And then also pumping. At the time, I think I rented a pump. It was through my insurance. I don't know if they do that anymore.
We've come a long way, baby.
It was the best one. It was Medela, I think it was called, and it was the best one. It was the only one that actually even works, because the rest of them were that squeezy thing. It was a manual one.
They have totally changed, Kate.
So I'm just curious, how it all works now. Yeah. Really aging myself over here.
Oh, it makes me smile. When I had my first in the hospital, they gave the Medela hand pump. It used to be.
That's what they gave me too.
I called it the breast masher. It had this long handle, and you kind of cram it onto your breast, and it was not a fun tool. Since 2012, when the ACA, the Affordable Care Act, went into effect, breastfeeding became part of the preventative women's health stipulations for the ACA.
Okay.
And the inclusion for a double electric breast pump for families was part of that legislation and part of that program. So since 2012, families have been able to get a double electric breast pump through their insurance provider or through third-party companies through insurance, which has really changed the whole dynamics of pumping. Prior to, I think in the 80s, Medela was the only company around. They still make a wonderful pump. They're still in the business. But there have been a lot of other pump companies that have come out as a result of this coverage, so that families have the pump. They can, it's a tool. If you're unable to feed at the breast, or you choose to pump or not feed at the breast, the pump is a way for you to still be able to provide breast milk. It also makes that transition back to work or school much easier for the nursing parent. So if they want to continue to provide breast milk for that 1 to 2 years, then they have that tool that can help them do that. So there's lots of great pumps that are on the market right now that families have access to. And if anybody has questions about that, they can always reach out to their lactation consultant or their hospital, and they'll help with that. As far as pumping to store milk away or make a freezer stash or introduce the bottle after delivery, the recommendations for that bottle introduction and starting to pump to store milk is to wait until breastfeeding is well established. For most families, that's about 3 to 4 weeks.
Oh, okay.
Families who are undergoing breastfeeding challenges, those booby traps I mentioned earlier, they might need to introduce pumping earlier than the 3 to 4 weeks because they're managing a breastfeeding situation, an infant feeding situation. But for families where breastfeeding maybe is a puppy dog and unicorn experience and everything's just wonderful, after they get that, a couple of weeks under their belt and they feel really good and confident with what's going on, then we'll talk to them about pumping to store some milk away. And I think what you were alluding to is when you're feeding the baby at the breast and then you're adding pumping into it, how do you do that without interfering with the feeding or throwing off your schedule? So we usually ask moms to, maybe take a look at their day, see what time of the day they make the most milk. It's almost always in the morning. I don't know what it is. Those nighttime hours are magical. There's lots of theories why. But usually we'll recommend going ahead and feeding the baby. And then if you want to go ahead and pump right after the feeding, you'll be able to pump that residual milk. And that can be the start of you getting a storage stash together.
Interesting.
And it's not something you have to do every day because, I threw out before milk production is based on milk removal. So if we started pumping after every feeding or we started pumping after every morning feeding, we're establishing a new routine and your body's going to adjust. That supply is going to equal the demand. If we start asking for more milk, the body's going to make more milk. So we don't want to add more work to the nursing parent's load. We want to try to keep things really simple. So I usually recommend just pumping occasionally enough so that you can store that milk away, but you're not establishing this new routine that has to be maintained every day.
Okay. Interesting.
And then the milk that's stored can be used for all future feedings. We do recommend introducing a bottle around the same time that we recommend pumping because for most families, we need to know there's another way to feed the baby when the nursing parent's not available. So that bottle introduction is important, and that has to be, we usually recommend doing it, again, occasionally so that the baby keeps the skill up. I sometimes receive some frantic calls from parents who are returning to work who maybe did introduce the bottle at around 3 or 4 weeks, and now they're getting down to the wire where they're returning to work and they hadn't kept that bottle as part of their routine or every now and then giving it. And when you have that return to work date like looming over you and the baby's refusing a bottle, that can cause a lot of anxiety.
Oh, yeah.
So for families who are in that situation, just know, that's just another reason to reach out and get some help. But you can imagine it makes you're already anxious enough trying to figure out how to navigate new routines when you return to work and finding a way to make sure the baby can feed is.
I found with that the often just like changing the bottle or like the nipple, like this different brand or whatever. Like I think helps
if
with
only
me.
it were that easy
I don't know.
for
That was
everybody.
my experience.
Certainly, changing the bottle. The bottles the nipples are different sizes or shapes and flows. We usually recommend using whatever nipple works for the baby.
Right.
There is not one out there that looks like
it's not the
that
unicorn
nursing parents nipples. So you can experiment, but sometimes regardless of that experimentation and keeping with that slow flow, which is what we recommend, babies still there are still some babies who will struggle with going to the bottle.
Okay.
Hence the recommendation, I'll just repeat, to introduce it a little bit earlier once breastfeeding's well established around that 3 to 4 week marker.
Okay.
And then doing it every now and then.
Good to know. The word is escaping me now, but there are complications that can happen from breastfeeding. So if you are kind of in your routine and then you develop it, what is it? The
mastitis?
Mastitis, yeah.
Oh, I'm so glad you asked about that because the new mastitis guidelines came out last summer and they're just kind of trickling down out and disseminating out into the real world. So mastitis is just a really fancy name for breast inflammation. So when mothers are nursing, are expressing milk, if they experience breast inflammation, that tissue surrounding the ductal system in the breast gets swollen and then the milk does not drain as easily. So the ducts are super fragile. I'm hesitant. I don't know how much detail I should go in without like your eyes glazing over here.
No.
So inside the breast, there's glandular tissue. This is where the milk is made. And then the glandular tissue connects to the ductal system, which then connects to the nipple. And that's how the milk leaves the glandular tissue, goes through the ductal system and gets to the baby. So when the tissue is all inflamed in the breast, those ducts are really fragile. They get compressed, and then the milk doesn't drain. And then the breast gets more inflamed, and then it can cause some pain for the mother, some redness in the area where it's not draining. Sometimes her breast might feel hot or tender to the touch. And if those symptoms are worsening or not resolving, then antibiotic therapy might be needed. So the treatment guidelines is to reduce the inflammation by maintaining the schedule that the mother is either nursing or expressing her milk on, and then utilizing ice packs and ibuprofen to reduce the inflammation.
Oh, you can take that. Okay.
Yeah, ibuprofen is Motrin or Advil. It's not recommended during pregnancy, but it is kind of the drug du jour, provided the nursing parents are able to take it to manage any postpartum pain.
Okay.
And also for breast pain as well. But it serves as a anti-inflammatory. So it helps with the pain, but it's also reducing the inflammation, which is why it's usually preferred over the Tylenol.
Okay.
Now, if a parent dives into the internet rabbit hole, this is where the internet's wonderful. We definitely have a lot more information at our fingertips than we did when my kids were little, but it can also complicate things when you're looking for some quick answers.
Totally.
So there's a lot of information about using heat or massage to manage mastitis that you'll still find on the internet. And in those cases, if it's just like a warm shower prior to expressing, or a warm washcloth on the breast prior to feeding the baby or pumping, that's probably not going to do much damage. But if it's excessive heat and excessive massage, then it makes the tissue inflammation so much worse. And a lot of times we'll meet families who have gotten that information either online or from friends or family, and then it's a much longer process to get that inflammation to resolve.
Okay. And then if it does progress, is it true that you can't nurse during that time frame?
No. So nursing, maintaining that schedule of either feeding at the breast or pumping is what we would want you to do.
Okay.
It's part of the solution so that you can get that milk out. Because if the milk is sitting there and it's not leaving the breast gets more and more inflamed. And then the mother runs the risk of an infection needing antibiotic therapy, or even an abscess where the milk comes out on the breast in a different area.
Oh,
it surfaces. And that's really painful. And it's not something we would want any nursing parent to experience.
Wow. Oh, my gosh.
It's very rare because we can manage it and correct it. According to Casi Leahy, I really do think like every nursing parent should know how to manage mastitis. And I think 95 to 98% of the time, with just maintaining that nursing schedule, our pumping schedule, and ice packs and ibuprofen, we can turn those bad boy situations around really easily and avoid any need for antibiotic.
Okay. Are there guidelines? Is this, I don't even know how I would phrase this. If you're not nursing, but you want your child to have breast milk, is it safe to get breast milk from other people that store it? How does that work? What is it even called?
That's it. There's two names for it. So I'm going to talk about donor milk. Pasteurized first. So in the U.S., we've got milk banks that are part of the North American Human Milk Banking Association. Mm-hmm. And these are sites that follow specific guidelines for pasteurizing milk. The milk they get is donated. They're not purchasing milk. There's no ethical issues involved. So if you were a mother who had a really large supply and you weren't going to be using this milk, you might choose to donate to one of these nonprofit organizations. And then they go ahead and they pull the milk together, they process it, they pasteurize it, and then it's usually used for our most vulnerable populations. So right now here in New Jersey, a lot of our donor milk is used in the NICU setting. So at Hackensack University Medical Center and Jersey Shore University Medical Center, we have level 3 neonatal facilities. So we use donor milk for those vulnerable babies because we do recognize the health benefits and the nutritional benefits of the breast milk.
Do they have to test it first for like anything that might not be?
Getting it from that milk bank means that testing's already been done, which is really a great way to, look at that. All the testing's done. It's safe. It's ready to use. We do get consent from parents. It's parents' choice to use it. But I'll be honest, most families want to use that donor milk. They want it available. I'd love to see a day where we've got donor milk available for any family that needs it. We did pass legislation here in New Jersey, I think it was back in 2019, that covers the cost of donor milk use for families, including our Medicaid families. As far as that legislation is in place, but the actions really haven't, we're still working on implementing that legislation to make donor milk available for families who need it.
Okay.
And so it's a work in progress, but it's exciting to think about. Like, I'd love to see a day where, for families, even you had talked about your son having jaundice. Was it?
Yep.
So in a hospital situation, when something like that arises, we know that feeding the baby is a way to help clear the bilirubin from the baby's body.
Oh.
So for families who want to breastfeed, they can feed at the breast, but if we needed to medically supplement the baby along with those feedings at the breast and breast milk wasn't available, then formula is our next option. If we had donor milk, though, that would give the family another choice.
Okay. We talked about how donor banks, right, or milk banks exist, where I know also like some people like sell their milk and like kind of it's almost like a street type of thing. Is that like okay? So is that
different?
Is that legal? Like is that like accepted within the breastfeeding community? Like how does that all kind of work? Because I'm assuming it hasn't been tested. So
it's a great question. So that's called informal milk sharing, and it's if we go back in time. The idea or the concept isn't new.
It's like milkmaids, right?
Yes. So the concept is not new, but talking about it here in like our society today, I'm going to give you like the on-the-record response and then the off-the-record response. So the on-the-record response from the healthcare providers, that's not pasteurized milk. And there are home pasteurization methods that parents might implement, but it's not going through any testing. You don't know where the milk is coming from. Sometimes you might be finding these connections on Facebook or other social media sites. And that can get a little tricky. They did a study a few years ago looking at the donor milk and testing it. The study was a little flawed because the milk they were asking for the milk and offering payment for it, and then it was being shipped and it wasn't being shipped properly. So you can imagine like that was, when they did the testing was not safe, safe breast milk. But for local groups, I can speak with just what I'm aware of is happening. Families often connect with other parents in their own community, and that's how the informal milk is, the exchange is happening.
Okay.
My off-the-record response is, in some cases, those organizations on Facebook and other social media sites might be doing a better job at getting donor milk to families than other options.
Got it. Okay.
And we need to recognize that the families are interested in that, whether they're families who are adopted, same-sex couples.
Right.
We're talking about breast milk being best for the baby, and if they don't have a way to get breast milk for their babies and they're choosing to use that instead of formula, then we need to provide better options for them.
Okay.
It's not an unlimited resource, so there is going to, that issue has to be kept in mind. But for families who are interested in, donating, you can find information about the Human Milk Banking Association of North America online, and the donation process is really easy. You can call, they'll talk you through it. There is some blood work that's needed. A lot of times that's already been drawn by the obstetrician, so it should be available to the parents, and then they arrange for shipping. The cost for the donation for the person donating is nothing. And then the milk is processed and then dispensed according to need by the facility.
Oh, wow. That's incredible. Let's talk about formula.
Okay.
when I had keep referencing my son, I have a daughter too, who I also nursed, but it was a different time. I did not nurse her as long, actually. I only did it up until my maternity leave, which was 12 weeks. So, and then I introduced formula. I think back in both situations, there was really only 2 companies who provided formula at the time. Now I think there's many more.
You assume wrong.
Oh, there's not.
That's one of the reasons why the formula shortage a few months ago was such a big conundrum.
Okay.
There's only 3 big companies in the United States that make formula.
And then,
Abbott Labs,
I see.
Mead
Okay.
Johnson, and Nestle.
Okay.
So when we look at formulas, for example, Target or Costco might have their formula, Kirkland, they're made by one of the 3 companies, which was such a nice life lesson for those who were maybe brand dependent prior to this formula shortage. What we wanted families to know during that is if you had a brand allegiance and you were unable to find that brand, that you should have, be looking for other infant-based formulas, because the caloric content of that infant-based formula is standardized. That's part of the FDA regulations, and it's standardized to match the caloric content of the breast milk. So we really wanted families, to use what they could find
and that it was sufficient, not just because of the label, basically.
Correct.
Okay. So what have there been advancements in formula? And are they able to replicate a lot of, what the health benefits of breast milk? And, do you see that changing at all in terms of, what would be accessible to parents had they, decide not to breastfeed?
Good questions. I think when it comes to breastfeeding and breast milk and women's health, we are just at the tip of the iceberg. We haven't, this is a relatively new field in healthcare. Even though that might be surprising for people to hear, we're just starting to do a lot of research and learn all about these things. So in regards to is formula like breast milk? No, it's not. It's completely different. However, it's your best alternative. If you are choosing not to breastfeed, or you run into any of those challenges that we kind of alluded to earlier, formula is what should be used. So when I'm talking with new families, I really want to hone in on that. Formula should be used if we need it. If a baby is unable to feed at the breast, or the mother is pumping and either doesn't have enough breast milk or hasn't expressed breast milk yet, formula should be used. And those are our 2 options.
Right.
Sugar water, sterile water, those things, babies don't need that. That's not nutritionally going to be helpful for them.
Okay.
The formula is designed to meet the nutritional needs of the baby and should be used without hesitation when we need it. The composition, that's where the magic happens with the breast milk. There's all these, it's a live culture. There's white blood cells, there's lots of benefits. We've been unable to duplicate that in the formula, but we can duplicate the calories and, again, design a product that's safe for infants to feed.
Got it. This thought just crossed my mind about breast milk, and I don't know if I saw it at a movie or something I saw on social media, but that it's we all know that the colostrum itself, they say it's like liquid gold, right? There's incredible health benefits just in that first, I guess, day or 2 of nursing. But breast milk itself, some women, I've seen that they put it on babies' cuts and different things, and it is like a miracle healer. Is that true?
Yeah, it's I forget what brand. I think it's some hot sauce, and they're you can put that on everything. Yeah, that's kind of how people look at breast milk. You can put that on anything. Oh, your eye's a little red. Put some breast milk in there. You got a little rash. Put some breast milk on it.
Yeah.
So breast milk, going back to that live culture component, it's got antibacterial and antifungal properties. So we do kind of tout it as this magical substance. There's a lot of cool stuff that. I'll talk a little bit about the colostrum. So some parents don't know, you start making milk really early on during your pregnancy. Your body's preparing for the baby, preparing to feed the baby. And all of this is happening whether the parent is choosing to breastfeed or not. If we have a mother that delivers early and delivers a premature baby, that breast milk and the composition of that milk is very different than parents who deliver at 40 weeks or full term. The breast milk that is made earlier on is designed, the body knows the baby came early, and it's got different compositions in it to help that premature infant.
Wow.
So it's like really magical when you think about, like, it's not the same food every feeding. It changes all the time. There's some newer research that came out that talks about like the communication between the baby and the breast. So we know that the breast milk is that passive immunity, like it's helpful. It helps to booster the immune system of the baby. But what we didn't realize, and we're just learning about, is that the baby also can communicate with the breast. So there's this idea that when the baby goes to the breast, their saliva might get into the ductal system. So if the baby was sick and was nursing, that composition of the breast milk changes.
Wow.
Because of the communication with the baby. So that's just so cool. And how it happens, is not understood at this point in time. It's just, something they're investigating. I'm hoping that we're going to learn more about it as time goes by.
Wow.
But I just think that's so cool.
That is very cool. Wow. Interesting. Can you breastfeed if you have implants?
Yeah, so breast surgery is really common. Breast augmentation with implants or even breast reductions. A lot of women will make decisions to have either of those types of surgeries. So for the augmentation with the implants, most of the implants we're seeing now, especially because breastfeeding, I'm going to talk about that in a minute. I'll deviate. Most of the surgical sites are under the muscle. So it's under the breast. It goes under the muscle. It doesn't interfere with the nervous system coming into the breast or interfere with that glandular tissue that I talked about earlier.
Gotcha. Okay.
So I think a lot of our breast surgeons, especially if they're working with younger women, are going to keep that in mind when they do the augmentation. When we start to have a surgical incision that goes into the breast or around the areola, or with the areola being removed or resized, that's where things can get a little trickier. But the advice we give any family who's had any type of breast surgery or biopsy is, we don't know. We're going to jump right in, just like we would with any other parent. And I think a lot of families are pleasantly surprised with the outcomes with breastfeeding post-surgery.
Interesting. Yeah. You have had to have been pregnant in order to produce breast milk, correct?
No,
I didn't think so. I thought so, but I wasn't sure. Okay.
I know. So there's all these like really cool things. So it's, we'll work with families who want to lactate. Some of them want to relactate. Maybe they breastfed, they had some challenges. They might have made a decision to move to formula and then later on want to go back to breastfeeding. So we call that relactation, and we'll help families through that process so that they can help rebuild their milk supply. We've worked with families who maybe are adopting and had children of their own and breastfed their own children. Now they're working with a new baby that they've adopted. That would be relactation as well.
But and if they've never been pregnant, they can produce?
And then we work with families who adopt that have never had children of their own or never breastfed, and we can work with them as well.
That's incredible. So this can all be done at the center?
Yes. And it's not something that can only be done there. Your obstetricians are also great resources when you have questions like this. But yes, we're very happy to help with that. I want to talk a little bit about the rates of breastfeeding and just because I feel like we missed that part about what's kind of changing here in the U.S. So back in the 1970s, the rate of breastfeeding here in the U.S., any breastfeeding, families initiating breastfeeding and all, was 25%.
Wow.
I know we were very much a bottle feeding culture in the 1970s. And now here we are, and the rates of breastfeeding nationwide right now are about 83 to 85%. I can speak with our area. We track these trends monthly at Jersey Shore. Our rate of initiation for families who are coming in to deliver is 90% of our families want to breastfeed to some degree. And that's really exciting. It really shows that, things have changed, and that's really wonderful. But
When do those rates drop off?
That's the conundrum. So here, everybody's gotten the message. We've got our recommendations. We've talked about breast being best, and that message is really wonderful. And families got it. They're making that decision to do it. But what's really important is that, and this is where the work still needs to be done. We can recognize that the rate of supplementation, introducing formula supplementation, the rates of exclusivity, and the rates of any breastfeeding change right after birth. So 85% of the families want to breastfeed, and then by 6 months of life, that exclusivity rate is about 23%.
Interesting.
It's interesting because I just got through earlier saying the recommendation is to exclusively breastfeed for 6 months. And we track the rate of even formula introduction in the hospital for non-medical reasons, and sometimes that can be high as well. So we've got to dive into why we have the recommendation, but we're not seeing those numbers where we need them to be, and that's where the work really needs to be done. And then different movements like the Baby-Friendly Hospital Initiative. I don't know how familiar you are with that.
No.
It's an international program that really focuses on evidence-based strategies that normalize breastfeeding and offer better support for families. So in the hospital setting, we focus on different strategies that we know will improve outcomes. So one of those things is to put babies skin to skin immediately after delivery. When we put them on that birthing parent's chest, it's for medical reasons. First of all, it will help for the baby to transition, stabilize their heart rate, their respiratory rate, their blood sugar, and their temperature. So they're coming out from that womb, which can be, 98 degrees. And here they're in the delivery room, which can be quite cold. Putting them on that nursing parent's chest helps them regulate their temperature, and then just makes the transition to life outside the womb much easier.
The mother and the father, or just the mother?
So it's so cool. With the mother, both parents can warm the baby up. Both parents are warm. But for the mother, not only will her body temperature will increase if the baby is cold, and it will decrease if the baby is too warm.
Wow.
I know. That's so cool, right?
Yeah.
So they've done studies on that. And I'm always like, that's so awesome. So the parent, the partner, the non-birthing parent, they will be able to warm the baby, but they don't have that same decreasing the temperature if the baby gets too warm.
Interesting.
So, and it makes them better feeders. So regardless of the parent's feeding choice, that skin to skin is always recommended. And then introducing, if the family has chosen to breastfeed, introducing breastfeeding as soon as possible, usually within that first hour of life, is the recommendation. Babies are really awake, they're alert, they're interested.
Okay.
So we like to go ahead and help them initiate that first feeding.
Wow.
And then we keep families together. We call it rooming in. It's just a nice way of saying family-centric care. When a family comes into the hospital, they're with us for such a short amount of time. And they've got a lot to learn. Maybe they've taken classes, but holding the baby, changing them, burping them, feeding them, these are all things that we really want them to feel comfortable with before they head home.
Yeah, it's a lot.
And you've got 24/7 support in the hospital, so you should take advantage of it while you're there.
That's right. We didn't talk about are there guidelines on what you're allowed to eat? I know obviously drugs, any type of medication, you should ask your physician. But in terms of any nutritional guidelines, has that changed? Are there more strict guidelines about what you're allowed to eat? Is it true that if you eat spicy food, the baby, the breast milk's spicy? What do you think about all of that?
The diet recommendation is there isn't any food that I would say you have to restrict. Certainly alcohol, I think, we'll just start there. Alcohol is not recommended for pregnant families. For recommendations for breastfeeding, maybe I shouldn't have opened with that, but I'm going to finish my thought.
No, a lot of women
People ask about
right?
it.
Yeah,
so,
the pump and dump, right? I'll just pump and dump or whatever. Is that true? Can you do that? Or
so if the recommendations for the last 4 decades have been, if you're having 1 beer, 1 glass of wine, 1 small drink, it's not considered to be a contraindication with breastfeeding. If you exceed that amount, then the recommendation would be to pump and discard the milk until you're no longer intoxicated. So if you can't drive, you shouldn't be offering the breast milk. If for families who attend an event who might exceed that more than one glass and they've pumped and discarded their milk, even the next morning they may not feel so good. They may be a little hungover, especially if they haven't had a drink for
9 months.
9-10 months. We always remind them, alcohol is not stored in the breast milk. Once it leaves the bloodstream, it's no longer in the body. But as far as diet's concerned, I think a lot of people are surprised to learn, I don't recommend any specific elimination for any family. Eat whatever you normally eat. The baby's been exposed to a lot of those things in the womb anyway.
Right.
So no, spicy, there's a lot of wives' tales about breastfeeding and parenting stuff. But spicy foods, I remember, gosh, this is embarrassing. Maybe I shouldn't tell this story, but I'm going to tell it. I went home. We were going home with my first son, Connor, who is now 26 years old.
Aw.
And we stopped for lunch on the way home. I know it's strange. It's just had a baby. We left the hospital. I was starving. And so we went out and I ordered broccoli and cheese, broccoli cheddar soup. And my husband was looking at me and the waiter's standing there and he's like, Casi, are you sure you want to order that? I'm like, what are you talking about? Of course I want to order. He goes, what about the gas? Oh. And I'm like, oh gosh, Ray, can you be any more embarrassing? No, that's fine. You can eat or drink. He was so concerned. He had heard broccoli wasn't good for a breastfeeding parent, that the baby would be gassy. I'm like,
but it's not true.
No, that's not true.
Oh, that's so funny.
So all these things, I think, you might have a situation where you eat something and the baby gets gassy, but it's most likely it's just a big quinky dink than anything
pass
else.
It along. Oh, that's so interesting.
There are situations, I'm going to call them rare situations, where we do have to adjust the mother's diet based on symptoms that the baby will display. And I'm going to go back to your situation with the colic behavior, the gassy behavior. One of the things we might have experimented with was there something in the maternal diet that was causing those symptoms? Mm-hmm. And I like to look at those issues as more of a sensitivity than an allergy. Sometimes dairy might be very hard for a baby to process. So if the mother eliminates dairy and soy from her diet, maybe we'll see those symptoms go away.
I see.
If we suspect that there is a dairy intolerance or milk protein allergy, then certainly we would not be able to use the infant formula, which is a dairy-based product. So for infants who do have a milk protein allergy that's been identified or diagnosed, then we'll use a hypoallergenic formula for them.
Oh, interesting. Okay. We talked about the support group that is offered in Monmouth County. Can you tell me a little bit about that?
Yes, it's my very favorite thing that I do. So we've got 2 support groups at Jersey Shore that have been around for a long time. We've got a new moms group that meets every Tuesday, and we've got a breastfeeding support group, the Bosom Buddies breastfeeding support group, that meets on Thursdays. Both of these groups are virtual. We moved to a virtual platform with our prenatal education and our support groups when COVID hit. And we found that a lot of our parents are able to attend because we've kept them virtual. So if families don't live in our area, if they can't get out of the house easily, if they've just had a cesarean delivery and they want to connect with other parents and with a healthcare provider who can answer questions, we really encourage them to join. It's such a great opportunity for them to connect with each other. So they're parent-led groups. They pick the discussion.
Oh.
We talk about any issues that they have. In the breastfeeding support group, we always joke that, breastfeeding brought us together, but we end up talking about a lot of other things other than breastfeeding.
I love that.
And then we'll have guest speakers come in occasionally throughout the year to talk about different topics that the parents are interested in.
And where is it held? Did you say that?
So it's virtual. So
it's virtual.
Yeah.
Okay, that's right. Yep. Okay, got it. Yeah, that's great. That's so much more convenient having to go somewhere.
If families are interested in learning more about the support group or getting the number for the center, we also have a Lactation Warmline, which is available 24/7. That's manned by our nurse lactation consultants. So for families who have any infant feeding question, whether it's breastfeeding related or formula feeding, we really encourage them to call us.
Okay.
Is there a way that we can share the numbers?
Yeah.
Okay.
So we'll link the numbers and the link to the center.
Oh, good. All right.
Thank you so much for coming on today. This has been incredible. I've learned a lot, and I hope that a lot of the parents listening are, getting some type of feeling a little bit better about the situation, right? That there's help out there, that there's support, and that no matter, where you are in your breastfeeding journey, that, that there is help available to you. If moms wanted to make an appointment, do they call? Do they go on the website?
It's always better to call.
Okay.
We do have a website, but I think the response is more timely when you call.
Okay.
So our Center for Breastfeeding is open Monday through Friday.
Okay, got it. So I'll link all of that there so they can have all that information. And as always, we'll link the Hackensack Meridian Children's Health site too, so you can just find out what other resources are available to you.
Okay.
Thank you again. This has been great.
Thank you, Kate.
Hopefully, moms will learn a little bit today, because I learned a lot, and now I will spread the word.
Okay. Thank you for having me. This was really fun.
Coming up, we have our 2023 back to school guide that just came out. We have extracurricular activities on there. We have where to shop. Even if your kids are already back in school, but I'm sure they're, saying, oh, I need this, I need new jeans. And then the weather's changing. So we have all kinds of boutiques in there, local boutiques of where to shop for kids, for tweens, for teens, for littles, malls, all kinds of places to go. Tutoring centers are in there. We also have the list of preschools and private schools. So all things back to school on our listen guides page. Coming up also, we have make sure you're registered for our fall festival happening on Sunday, October 22nd at Bellworks in Homedale, New Jersey. We have a full kids zone. We have really cool touch-a-truck. We added, thank you to the Monmouth County Public Works Department. They are bringing some very cool trucks this time, excavators and all kinds of digging devices.
Always popular, the touch-a-truck.
Yeah. So very cool things that we're adding to that. We also have vendors coming. It's a week before Halloween. Come in costume. There'll be candy. There'll be food. We do have Barbella open again, so you can get a cocktail if you'd like. We have some fall, like a fall menu we put together, and shop early for the holidays, because that'll be right around the corner. So we have really cool vendors. You can do some really Christmas shopping and just enjoy a really nice community day. It's always fun. Hopefully the weather's great. It will be.
I was here for your last event, and it was wonderful. And the vendors were great. There are lots of good gift options, for sure.
Yeah. Oh, thank you. Yeah, the springtime one was good. Yeah. So that's coming up. And as always, look to us for all things that you'll need as we head into the fall. Grab and go options for food, healthcare resources, obviously, and everything in between to help you through motherhood. Thank you so much. Have a great day, everyone.